Hello everyone and welcome back to Ultrasound teaching videos with Dr. Arshad Nadeem Awan. Hope you're all okay, you're all enjoying and you're all watching my videos and also enjoying practicing ultrasonography. Today my topic of discussion is chronic pancreatitis. Chronic pancreatitis is characterized by irreversible damage to the pancreas. This chronic inflammation leading to irreversible damage of the pancreatic gland. So far the histology is concerned, on histology you will find the fibrosis, you will find the chronic inflammation, acinar atrophy and ductal abnormality and ductal dilatation. Sometimes you will also come across with distortion of the pancreatic duct as well. Chronic pancreatitis ultimately leads to parenchymal damage with the deficient endocrine and exocrine function. As far as its everlasting and long-lasting morphological changes are concerned, it include parenchymal echogenicity changes, glandular enlargement, sometime in the latter stage glandular atrophy with parenchymal calcification, ductal dilatation, intraductal calcification, and you will also come across with the complication of pseudopancreatic cyst. So these are all about the chronic pancreatitis. There are multiple causes of the chronic pancreatitis. On the top and the predominant cause of chronic pancreatitis is alcoholism. 70 to 90% contributes alcoholism in causing chronic pancreatitis in Western countries. The second most common cause for the chronic pancreatitis is obstruction of the pancreatic duct, usually because of stricture, sometimes because of malignant or benign masses. Hypertriglyceride level if increased in the blood, it also causes chronic pancreatitis. Hypercalcemia. Chronic pancreatitis is also caused by autoimmune pancreatitis or tropical pancreatitis. Beside this, certain mutation abnormality also leads to chronic pancreatitis. Major sign and symptom of the chronic pancreatitis are epigastric pain, malabsorption and development of the diabetes. These three are the major sign and symptoms of the chronic pancreatitis. So far the treatment are concerned, there are two types of the treatments available. The one is conservative treatment. Conservative treatment is the main purpose of the conservative treatment is to alleviate the pain and mitigate the malabsorption and diabetes as well. As far as surgical interventions are concerned, it is reserved only for the complication purpose. Likewise, pseudopancreatic cyst for the abscesses and for the malignancy, the intervention procedures are performed in chronic pancreatitis. On ultrasound imaging, it shows multiple presentations including parenchymal changes, parenchymal increase and decrease echogenicity, ductal dilatation, intraductal calcification. But CT scan is superior to the ultrasound just to pick the complications and see the picture at great length. Ultrasound depict echogenic abnormalities related to the parenchyma due to the fibrosis, increase and decrease enhancement, increase and decrease echogenicity. This will show chronic pancreatitis changes. You can pick also ductal dilatation, intraductal calcification as well. You can also pick certain complications including abscesses and formation of pseudocyst. How it will look on the ultrasound images, how we will appreciate that on the sonography, how we will write an effective report and communicate with our colleagues for the further management. Let's start watching these images for better understanding. This transverse image of the pancreatic body shows a beaded dilated pancreatic duct resulting from chronic pancreatitis. Pancreatic duct is clearly visible. Ductal dilatation is also clearly visible, but you can see that the wall of the ducts are irregular, giving rise to a beaded shape. This is because of fibrosis of the pancreas. Smoothness of pancreatic duct walls are no longer maintained because of the fibrosis. So chronic pancreatitis patients' images will directly attract your attention once you carefully look for the dilatation of bile duct. On this slide, pancreas is small in size. As usually in the pancreatitis, pancreas would be small in size. But you can see on this image a small echogenic foci can be seen within the pancreatic duct. This is technically a calcific focus, but the term is applied as stone. So this is the stone in the pancreatic duct which initiate the inflammatory response due to the obstruction, and as a result you will see all the pancreatic juices, pancreatic enzyme will start accumulating within the pancreatic parenchyma, which eventually results in the inflammatory response. So always look for intraluminal space of dilated pancreatic duct. Certain intraductal tumors are very common. I will talk in detail while I will discuss neoplasm of the pancreas. This slide is a classic presentation of chronic pancreatitis. In the pancreatitis there will be small size echogenic pancreas, or there will be multiple calcific foci within it. So pancreas is small in size due to fibrosis, and multiple dense calcific foci are seen replacing the pancreatic parenchyma. Pancreatic duct is also enlarged. In that case, that you can see centrally there is enlarged pancreatic duct. However, within the pancreatic duct you can't appreciate any calcific foci or any tumor. This presentation is very common in chronic pancreatitis. So in chronic pancreatitis, either the pancreas will appear an echogenic, or you will be able to appreciate definite calcification within it. This is another slide of the chronic pancreatitis, and here on these images you can appreciate pancreatic calcification as well. On the left side there is pancreas small in size with multiple parenchymal calcification, while on the right side Doppler signal has been put to just confirm whether there is increased vascularity or not. But you can see there is vascularity within the pancreatic parenchyma. It's mean that inflammatory response is also there. So this is also a classic pancreatitis, especially chronic pancreatitis presentation. It will appear like this. Pancreatitis reporting is very important. While you are writing the report, you must mention that pancreas is small in size. If it is diffusely small, so mention it is diffusely head, body and tail is small with alter parenchymal echogenicity, because I mentioned that in few cases there will be echogenic small size pancreas. This will also represent chronic pancreatitis, but in few cases you can see many changes. Maybe there is tumor, maybe there is calcification. So mention that multiple dense calcific foci or calcifications are seen. Pancreatic duct is dilated, however no stone or mass seen in it. If there is any mass, mention that mass is there, or if there is any stone, mention that stone is there. While writing the conclusion, mention that features are in keeping with chronic pancreatitis and correlation with serum amylase and lipase is suggested. If patient is symptomatic, then must advise that a CT scan with pancreatic protocol is advised for further workup. One of the major complications of the chronic pancreatitis is development of pancreatic pseudocyst. Here in this slide you can see pseudopancreatic cyst superior to the pancreas. It's a well-defined isoechoic cystic lesion. You will have to measure the size in 3 dimensions and also mention its location. Usually you can see around the pancreas, in the vicinity of pancreas, in the area of epigastric, and also look for intramural calcification or nodule or any low level echos, because within the pancreatic cyst sometime due to the hemorrhage you can appreciate the low level echos. Here on these 2 images you can appreciate pseudopancreatic cyst. On the left side there is liver visible. You can appreciate the liver, but adjacent to the liver there is a well-defined simple, it's not the simple cyst but a well-defined round cyst with internal low level echos. This is actually hemorrhagic cyst, and this is within the tail region of the pancreas. This cyst was confirmed on the CT images. On the right side you can see the CT image where you can appreciate the liver, and just adjacent to the liver towards the left side, you can appreciate a complex cystic lesion with a low level internal echoes, and you can also appreciate fluid level, which is a characteristic of hemorrhagic cyst on the CT scan. So this is pseudo pancreatic cyst in the tail region of the pancreas. While writing the report for the pseudopancreatic cyst, you have to mention that a well-defined complex cystic lesion. Whenever there is low level echoes, it will not be any more simple cyst, it would be considered as complex cyst. Give it measurement in 3 dimensions. Is seen in the epigastric region. Whatever the region you have seen the cyst, you must mention that. Low level internal echoes or debris are seen. If there is calcification, mention the calcification. If low level echoes are there, mention the low level echoes, or soft tissue components, mention that. In the conclusion, mention that features are suggestive of complex cyst with hemorrhagic contents, likely pseudopancreatic cyst, and always advise further workup. CT scan is the next modality to confirm the pseudopancreatic cyst. Again, this is another slide of a pancreatic duct stone. You can see that pancreatic duct shows a small calcific foci within it. Take the measurement of the stone. Mention that pancreatic duct is dilated and 3 mm or 5 mm stone is seen in it. And this further comment on the pancreas. If it is small in size, mention the small in size and give in the comment that pancreatic duct stone. On this next slide, you can appreciate another hemorrhagic pseudocyst, but this is actually in the head region. You can appreciate that pancreas is on the top of it, and you can see the complex cystic lesion underneath the pancreas more towards the head region. So this is another example of a hemorrhagic pseudocyst in the head region. So therefore, it is very important to observe the location and vicinity of the cystic lesion. Also observe whether there is some internal echoes or internal contents within the cyst, and beside this, always try to look for the communication with the pancreas. Sometimes you can see clear communication with the pancreas. If not, still this vicinity, this area shows that there would have been any relation with the pancreas, and this would be pancreatic cyst. On this slide, you can see pancreatic duct stones. In the previous slide, you have seen a single stone within the pancreatic duct, but here you can appreciate multiple pancreatic duct stones. These stones are responsible to initiate the inflammatory response. Sometimes you can see active inflammatory response by putting Doppler signals on it, and you will see the vascularity, and sometimes this will be impacted within the pancreatic duct. So therefore, in either way, these are the symptoms, these are the signs on the ultrasonography for the chronic pancreatitis. So chronic pancreatitis may show pancreatic duct stones. Autoimmune pancreatitis is a mass-like imitator of the pancreatic carcinoma. You cannot easily distinguish between both. It will be a focal hypoequic area, will be more mimicking as a tumor. Previously, it was considered as idiopathic pancreatitis. Another term, sclerosing pancreatitis, was also used for this autoimmune pancreatitis. How it will look on the images, how we will differentiate it from the tumor, and what other radiological imaging would be required to pick the autoimmune pancreatitis. Another category of chronic pancreatitis is autoimmune pancreatitis. As the name shows that autoimmune response will initiate the pancreatitis. So autoimmune pancreatitis mimic as tumor. So you cannot easily differentiate on the ultrasound imaging whether it is tumor or it is autoimmune pancreatitis. So it will appear as a tumor on the ultrasound imaging. Therefore, care must be taken when you come across any tumor or any focal tumor lesion on the ultrasonography. Many a time it happens to be focal pancreatitis, and if you can see the tumor, still you should not consider that it may be tumor, but you can put in your differential that it might be autoimmune pancreatitis, and further imaging is always required to confirm your diagnosis. One another point here, it's worth mentioning that while differentiating between the mass and the autoimmune pancreatitis, you just put the Doppler signals on it. Here on this slide you can see that on the right side there is a mass in the head of the pancreas. That is actually not the mass, it is actually autoimmune pancreatitis, while in the surrounding there is vascularity visible. In the mass lesion, if there is vascularity visible, so then you can consider it as a mass. Otherwise, if there is no vascularity, so there might be inflammatory changes, and that would be autoimmune pancreatitis, but again confirmed with other radiological imaging. While writing the report for the autoimmune pancreatitis, your report should contain all these information. Write down that a poorly defined, predominant hypoequic lesion measuring, give its measurement in 3 dimension, is seen in the pancreatic head, whatever the site is, either head or body or tail, but it is seen most common in the head region. So pancreatic body and tail is unremarkable. Hypervascularity noted around the pancreas, however, no vascularity noted within the lesion. In the conclusion, mention that findings are suggestive of focal pancreatitis, may likely be autoimmune. Possibility of tumors cannot be excluded on the ultrasonography, so CT scan with pancreatic protocol is recommended. This report contains all the information regarding the lesion seen on the ultrasound, its measurement, its size, its characteristics, and beside this you have already given your differentials. You can consider it as a focal pancreatitis, or you also consider it as a tumor. For that purpose, you have advised that further workup, further radiological imaging is recommended. And for the pancreas, the best modality is CT scan, but CT scan with the pancreatic protocol. This is the recommended ideal investigation for the pancreas. Yes guys, this was all about chronic pancreatitis. We have discussed all points related to chronic pancreatitis at length. We have briefly discussed about the causative factors, signs and symptoms, and management. And I'm sure that these images will help you to understand chronic pancreatitis in better way. Beside this, you will be able to pick the complication of the chronic pancreatitis on the ultrasonography. I would like to say thanks to those people who are regularly sending me their feedbacks. So please keep watching my videos, keep sharing with other radiology students, with ultrasound students, and keep sending me feedbacks. With some other videos in the next session, we will meet. Till then, take great care of yourself and keep watching my videos as well. See you then. Bye bye.